Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor for, holy cow, starting on my 27th year, coming up in March. I have a lot to say about this particular study. Before I get into this study that looked at how providers counsel, communicate, relate to patients with back pain. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel. So this was a study out of Australia looking at, they asked 16 PTs and 16 chiropractors about communication with their patients. There was a variety of experience from as low as 2 years up to I think 24 years. And in asking these providers, there were 4 things that were identified. And the first one is that reassurance is critical. And so nobody disagrees that we need to reassure the patient. This means things like when the patient comes in, I have these conversations all the time, talking them off the ledge. So, gosh, the back pain hurts. I'm pretty confident it's going to be better in a visit or 2. This isn't a 3 times a week for 10 weeks type of scenario, and you're not going to be living with this for the rest of your life. So reassuring that it's going to get better. Reassuring that so long as there's no red flags, that we're not dealing with a fatal condition or a fracture or infection every time a patient comes through the office. Even though I don't address those, I'm talking about infection, fracture, tumors, those kind of things always run through my brain to see if something is typical or is consistent with something a little bit more dire than what the patient is presenting with. So those reassuring the patient that this isn't serious, it's not life-threatening, it's not fatal, and you're going to get back to life. The other thing is reassuring on movement. And holy cow, you've heard me say this 100 times. And if you were in my office, you'd hear it 100 times more. We have to move. And if we don't, there is no... I always say couch potatoes are notoriously hard to fix, and the athletes get better much faster. So all of the providers in this study agree that reassurance is important, and those were 3 critical factors in there. We want to make sure, and number 2, that all providers really noted that time and practice and experience had a lot to do with how well we communicate that. So if you're 1 year out of school, 6 months out of school versus 27 years out of school, you have a much broader experience with seeing patients get better, and that helps you communicate better with the patients. That was number 2. Number 3, they all admitted that there are some scenarios that are challenging, so that's where some of the experience and learning how to communicate better with a patient is important and critical. So this may be a patient who comes in and says, I hear it all the time, that, oh yeah, my disc bulge that I had 20 years ago, it's bothering me again. No, it's not the disc bulge you had from 20 years ago. And that raises the fact of early MRIs and early imaging, which is done very frequently. And all of a sudden people get this idea in their head that they have something's broken, even if what's broken on imaging doesn't correlate with what the patient presents with. Perfect example, they've got a raging huge disc bulge on their left, but their pain is down the right leg. That's not uncommon, and those can be challenging for providers to kind of walk a patient through that. Also, if there are any red flags or chronicity, how long somebody's had this, their psychological state. There's something called PAM, or the patient activating measure. How well engaged are they at getting better? I have athletes, again, these patients come in, they're like, I don't know what the hell I need to do, but whatever it is, let me know so I can get out to doing whatever I need to do tomorrow. And then I have other people who will sit on the couch forever and not do anything to help themselves get better. And so their psychology plays a role in their outcomes. So dealing with all of these things are things I have dealt with over the years, and you just learn how to manage patients and their expectations. The fourth thing they determined was that these recommendations, these reassurances need to be individualized. Now that makes sense, but again, we boil back down to the education, or the experience and the time and practice for provider. You want to walk into a provider's office and you want to hear him say, oh my gosh, I've seen 15 cases just like this week, and they all got better. As opposed to, when it comes to medical conditions, you don't want to be the outlier. You don't want to be like, oh my God, I've never seen this before, but I read it in a textbook. But every patient that walks through the door is an individual scenario as far as how much they're going to engage in getting better, what put them there, psychological aspects. All of these things need to be meshed in with the patient experience. And this is why chiropractors generally rise to the top, is because we are much better at communicating these things. When we look at studies on manipulation only, that is not at all representative of what happens in a clinic. I know we do a lot of soft tissue, but a lot of that is engaging with the patients and reassuring them that things are going to get better and that they need to be moving to help them get better, especially with chronic conditions. But that's all part of the package, and why some providers are much better at managing these cases. And that's why a lot of times primary care docs are not the best, because they don't know how these things are going to trend, and they early order things like meds, imaging, and pain management, and that leads to things like more surgery. So, certainly a plug for chiropractors as the preferred portal of entry for any musculoskeletal ache or musculoskeletal pain, and that has showed out time and time again in studies. But this is just my additional plug to make sure that if you have a problem, your best bet is to see a chiropractor first. As always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.